So we'll be talking about the tetracyclines. Okay. We'll be having a look at tetracyclines. So tetracyclines these tetracyclines, we said that they're actually a broad class of what? Antibiotics. Yeah. So they're used to treat wide range of bacterial infections and all of that. So these drugs, they are particularly what effective against gram-positive and gram-negative bacteria. Alright, as well as atypical organisms such as chlamydia, mycoplasma, rickettsiae. Alright, so what's the mechanism of action? So they exert their antibacterial effect by binding to the 30th subunit of bacterial ribosomes. So this binding prevents the attachment of what? Aminoacyl-tRNA to the mRNA ribosome complex. So this is now what to now stop protein synthesis. Okay. Now as a result, the bacteria is unable to produce proteins, and proteins are needed for growth and multiplication. Even human beings need proteins. So tetracyclines, they basically what? They stop the growth of the bacteria. That means they are bacteriostatic. So spectrum of activity, they can be effective against gram-positive bacteria like Staphylococcus aureus, Streptococcus pneumoniae. Gram-negative bacteria like Escherichia coli, Haemophilus influenzae. Right. Also, it's used in gram-negative bacteria treatment. So gram-negative bacteria like all of them, Escherichia coli, Haemophilus influenzae. Used in treatment atypical bacterial infections from others than mycoplasma, chlamydia, rickettsiae. Used in treating infections from spirochetes, right, Borrelia burgdorferi. Then also treating what? Protozoan infections like Plasmodium. So these are the different types of tetracyclines that we have. The first generation, the second generation, the third generation. Please pause at this you understand? You can just pause here to look at all the generation. So pharmacokinetics, absorption, they are generally well absorbed from the gastrointestinal tract, but absorption can be affected by food, dairy products, antacids containing calcium, magnesium, aluminium. So these substances can bind to tetracyclines and reduce their absorption. Distribution, widely distributed in body, including your lungs, your liver, your kidneys, your skin. They also cross the placenta, excreted in breast milk. They also accumulate in tissues with high calcium content. Right. So metabolism, they are minimally metabolized in the liver, so most of the drug is excreted unchanged. Half-life is about 6 to 12 hours, right, which necessitates what? Multiple doses per day just to maintain its level in the body. Adverse effect is gastrointestinal linked, photosensitivity, can discolor your tooth. So now this is due to tetracycline ability to bind to calcium in different tissues containing high calcium levels like teeth and bones. So see this minocycline. So hepatic toxicity, renal toxicity can also kill the good bacteria, leaving the bad bacteria, leading to super infection. Right. So clinical use, it can be used in treating respiratory tract infections, skin infections like acne and rosacea, sexually transmitted infections, tick-borne diseases, malaria, rickettsiae infections,